Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Here we are, everyone, with Dr. Katie Lee. Thanks for being here, Doctor.
Thanks for having me. I'm really excited to have this conversation with you.
I am too. And the intro, when I was referring to speaking to you as the dentist and reading through the information that you sent about fertility and whatnot, my only experience that I was aware of really with my fertility was, or with dental situations, was when I was pregnant, not
Mm.
necessarily in my fertility journey, which again leads to the the thought that most of the REs that we work with, as much as they focus on fertility, it's a very narrow aspect of the full body, right? Like, I have gut issues. Nobody ever asks me about that. No one asks you what your dental health is, that sort of thing. But let's dive into this because also in regards to dental health, I feel like, well, why aren't we talking about this whole 40-page thing that you just sent? Because it's all relative to most of us. Of course, my audience were more concerned with fertility. However, it's like this whole Pandora's box of, oh my goodness, all of these things could be related somehow to our dental health. And I remember this short story. I had a dog that was like tiny, 4 or 5 pounds or something, and her teeth were horrendous and ended up getting all of her teeth out. And as soon as she got all of her teeth out, she became so healthy. Like, her heart got better, her health got better, her fur got better, like everything just got so much better because she had all this infection in her mouth. And the doctor was saying, of course, because the ratio between this little person or little fur baby compared to us obviously is relative, but essentially it's the same thing that happens to our bloodstream. So can you just give us an overall kind of 30-foot view, 30,000-foot view of how our dental health affects our overall health in general? Because I know I am so embarrassed to say I used to be one that goes every 6 months for a cleaning. And now I'm like, I don't know, like 18 months in, I think, or something. And I even said to my dentist on the phone, because I was talking about Dave's appointment, I'm like, I don't even want to go anymore because I'm nervous about going. She's like, you have to come. Otherwise, it's going to be worse. I'm like, I know. But it's like I said, it's not just about getting your teeth clean and checking that out. So tell us this overall umbrella about why our dental health is so important.
Sure. So, a lot of people forget that the mouth is actually the gateway or the entry point to the body. And so, over 100 years ago, someone thought it was a great idea to take the mouth out of the body and make it its own kind of specialty. And when they did that, they kind of removed it from medicine. But the mouth is actually the beginning of the digestive tract, right? That's where our
Mm.
digestion starts. And so the mouth really affects the body in two major ways. The one is we have an oral microbiome, which is the second largest microbiome in our body next to our gut. It's also important to note that the mouth is what seeds the gut bacteria. So when people
Mm.
are really into gut health and the gut microbiome and probiotics, that's wonderful. But they need to go back upstream a little bit and realize that you cannot have a healthy gut without a healthy mouth, because the mouth is what is seeding that gut microbiome. So
So what starts first, the chicken or the egg? So do you have the bad bacteria in your mouth first and then that kind of goes to your gut? In which case, I'll use myself as an example again. I had SIBO, which is small intestinal bacteria overgrowth, which I was very aware of, that I had a salad that I got sick from, and it kind of deepened into my intestinal tract, and then it became this big infection for years.
yeah.
Um, Obviously, that started in my mouth because I consumed something.
Yep.
Is that kind of what we're talking about? Is that initial, like,
Yeah.
okay, this meat was bad, or this
Yeah.
lettuce was bad, or whatever it was? I Is that where we're starting to talk
Yeah,
about?
it's coming in through the mouth. So it's either, if you eat something bad or maybe a bacteria on your hands, and then touching your mouth, but there's also the distinct microbiome of the mouth. And so when that gets out of whack also, and you start to get these pathogenic bacteria that are flourishing, when those get into our bloodstream and those bacteria enter our bloodstream through our gum tissue, actually, that's what causes damage to our whole body. So there's certain pathogens in the mouth that are only supposed to stay in the mouth, but because of inflammation, they start to disseminate throughout our body and they can harm things like our reproductive tract or our heart or our brain,
How
etc.
would you know if your mouth biome is off? I mean, our gut biome is pretty obvious, right? You're bloated or you have diarrhea or constipation or something's going on. How do you know if your mouth is not where it should be?
I would say the majority of patients, same, will know that it's off, although they may not be aware of all of the symptoms. So, a couple things that people need to be aware of is if you have kind of stubborn bad breath. Now, I'm not talking about morning breath. You've been asleep all night and you wake up and you have bad breath. That's normal. But if throughout the day you're noticing you have bad breath and you didn't eat garlic chicken or something, that's probably a sign, or that is a sign that your microbiome is off. If bleeding gums is going to be the big one, because if your gums are bleeding when you are brushing and flossing, then that means that you have an inflammatory response going on and your gum tissue is being broken down or perforated, and that's what's allowing the bacteria from your mouth into your bloodstream. So bleeding gums are going to be a big one. Mouth breathing is going to cause the microbiome to be off. So if someone has kind of stuffy nose or sinuses, or maybe they're snoring at night or breathing through their mouth, that's going to cause a dysbiosis. And then some other things that are more subtle are going to be, things like tooth sensitivity or receding gums. Things like that are going to be a sign that the microbiome is off. But there is a subset of the population that don't know. And so, just like we have tests in medicine, such as stool tests for the gut microbiome or blood tests to check our blood count or diabetes, blood sugar levels, we have saliva tests, which is something that I do to test the microbiome to see if it's in balance, because I work specifically with fertility patients. And I would say, I've been testing since 2014. I've had less than, oh gosh, 2025 tests come back totally fine. So it's
Hmm.
very rare that someone doesn't have some sort of issue, especially in today's day and age.
And what do you think the cause of that is?
Oh, there's so many things. So then we get into things like food, right? A lot of the food that we're eating is not great. It's not diverse. We're not getting enough fiber. I think that overall oral health care that people receive, in terms of the quality of the care as well as the frequency of the care, is woefully inadequate.
Mhm.
And then our environment, right? We're constantly under insult all day long, touching things and breathing things in that aren't necessarily clean. And if our immune systems aren't really set up to fight off those bacteria, we're going to get imbalanced and have an issue.
I think too, just having children the last uh, 8 years, and seeing how frequently they get sick, and saying to the pediatrician, like, "Is this normal? Like, I don't remember this happening." And they consistently were sick like every 3 weeks.
Mhm.
Somebody was sick once a month at least. And I think because when I was growing up, there wasn't this international travel. There wasn't people coming and going all the time with different situations happening. We have a big immigration situation where we live, and I think people are coming and going, and for better or worse, we get exposed to bacterias that we're not necessarily used to as well. And of course, with little kids putting stuff in their mouth and whatever, it's so gross, but it's continually happening all the time, I feel like. And even my little one, who's turned 5 today, he's still, I'm constantly saying, "Get your hands out of your mouth," like, "What are you doing? That you just had your hand over there on your bike or whatever, and now it's in your mouth. It's so gross." But I also don't know, like, am I being overly paranoid about that type of stuff too?
It's funny because I just got a picture from my son's daycare and they took a picture of him and he had a toy in his mouth. And I'm just like, oh my God, that's probably covered in snot. So I think another big part of it too is, we introduced kind of these mainstream oral health care products I think it was like in the 70s or 80s, that we're supposed to kill 99.9% of the bacteria, and we're putting fluoride in our toothpaste and we're doing all this stuff. And it has not had any sort of positive impact on reducing cavities or gum disease since they put it in. In fact, it's only gotten worse. Gum disease is on the rise, 34%.
Hmm.
Childhood cavities are still the number one disease of kids in the world. So I do think that there is value to some of that gross stuff. You don't want to touch someone's snot and then obviously put it in your mouth. But I think us using these products, I grew up on Scope mouthwash. I was a dental assistant before I was a dentist, and we had concentrated Scope in the dental office. And we would put a little bit of Scope and fill it up with water, but we would always skew the ratios a little bit because we wanted the burn. We
Hmm.
thought that was making us extra clean, and now we know that's horrible for your microbiome. And so I think we've been doing a pretty poor job supporting and growing our own robust microbiomes. I think we've been wiping them out for way too long, and it's had some negative effects.
So what can we do as a starting point to fix that? And then the second question that I was thinking of as you were talking was there was somewhere along the line that I had heard that part of your dental health is hereditary, right? Like my dad has really amazing teeth and never had any cavities, and my mom had awful teeth and had lots of cavities and things like that. Is that a thing of like I have genetically predisposed to X or Y, or is that not really a situation with dental
It's
health?
it's not really a situation. So there
Okay.
are some genetic conditions that will make your teeth softer. However, that is present in less than 5% of the population. So
Okay.
unless someone has this hereditary genetic condition, which you would know by looking at the teeth look mottled, discolored. There's yellow, brown, white spots. They don't look like normal teeth. I would say that is a case that is hereditary. For the most part, though, what is passed down between family members is the microbiome. So it is very
Mm.
common that someone will say, I have cavities, I have bad teeth, my mom had bad teeth. That's me. Because it's the bacteria that we're passing down. So I'm always telling people when they're thinking of getting pregnant, or if they're pregnant, or if they've just had a baby, both caregivers, mom, dad, if it's going to be grandparents, nannies, whatever, need to make sure that their mouth is in tip top shape, because anything that is in your mouth will be transferred to your child, because we're sharing utensils, we're touching, we're kissing. Um, all those things we're transferring bacteria, because when we're born, we're actually pretty much sterile. The first exposure we get to bacteria is through the birth canal, which is why vaginal birth is so important. And then after that, everything that we acquire, especially in our mouth, has been acquired over time, and it's usually from our caregivers. So that's why people usually say, bad teeth runs in families.
And why don't more dentists talk about the microbiome in your mouth?
There's no training on it. So I graduated in 2010. I will say that there are some universities now, some dental schools that are teaching about the microbiome, but it is just not part of education and curriculum. Just like the gut microbiome wasn't for Western physicians, right? It's all stuff that you have to learn, and we really haven't been able to test for it in the past. We knew it was there, but we didn't really know what's good, what's bad, what affects it. How do we even measure this or test it? And so there's been testing modalities out there for over a decade now, but this is all new stuff that we have to,
Okay.
as professionals, stay up on.
Okay, so let's dive into fertility and how our mouth can affect that. What is the number one thing that you see in relation to or correlation to fertility and somebody's, I guess, microbiome in their mouth?
Absolutely. So there's two bacteria in the mouth that we get really concerned about when it comes to fertility on both the man and the woman's side. Um, and that's going to be Fusobacterium nucleatum, so the FN bacteria. And then the other bacteria that we care a lot about is PG, Porphyromonas gingivalis. These bacteria work together. They go from the mouth through the gum tissue into the bloodstream, and they go to the female and male reproductive tracts, and they can have adverse implications all the way from trying to conceive to miscarriages, to preterm birth and low birth weight babies, and maternal complications such as gestational diabetes and preeclampsia. So, and it affects the man too. It affects their sperm count, their motility and morphology, and their ability to achieve erection. So both men and women are affected by this, and it kind of affects the whole gamut of reproductive health.
And you wouldn't necessarily know that you have these things unless you do a saliva test for them, or
Yeah,
how
I
do
would
you
say
find that out?
yeah. So, I always tell people on wherever you're at on your fertility journey, even if you're already pregnant, it's important to get a saliva test to see if these bacteria are present. Because if they are, it is totally safe and should be done to get rid of these bacteria before you deliver. That way you can try and have as healthiest, pregnancy as possible. And also help reduce the amount of bacteria that will be transferred to that baby afterwards. So, yeah, saliva test is really the only way to tell if you have it or not.
And how do you rid of these bacteria?
So, there's pretty basic things that your dentist can do. So, depending on the gum measurements, which is, when they go around the teeth and call out the numbers, depending on the measurements, that will determine the type of cleaning. Most often, when people have this bacteria present, they will also have bigger numbers on their gum measurements. And so that means a deep cleaning needs to be done.
Do you need to see a special dentist who knows about this? Because
Um,
I don't
yes,
know, like, I've never had my dentist be like, "Oh, the measurement of your gum on this tooth versus that tooth," or anything, it's just like, "Let's
yeah.
clean it, let's X-ray,"
Yeah, yeah.
whatnot.
So 2 things, they have to do the saliva test because you have to know if it's there, and then secondly,
Okay.
they must do the gum measurements. Every dentist knows and will do the gum measurements. I always tell patients you should get your gums measured every time you go to the dentist because your health can change in 90 days. So if you're not getting your gums measured, there's no way for that dentist to be able to tell if there's an issue just by looking at your teeth because what we're looking at is underneath the gum tissue. And we can't, without x ray vision, we can't see what's underneath that gum tissue. And these bacteria specifically, FN and PG, live under the gums. So if you're just doing a normal, regular, healthy mouth cleaning, that's only cleaning above the gum line. In order to treat these bacteria, you have to go underneath and get them.
And now I'm even more freaked out, Doctor
I
Lee,
know,
about not going to the dentist
you saying that it'd
and
been a
or going to, like, a new dentist for
yeah.
that matter.
You saying that it had been a while and then you then saying that you're having increased anxiety going back, that's something we hear all the time
Yeah,
actually, because it's like, "Oh gosh, I'm sure it's gonna be really bad now, I just don't wanna hear the news."
right.
So that's really common, you're not alone in that.
And I also, it's something that I love to do. It's, if I had time and I could go all the time and it's easy, I would be there as much as I possibly could. I feel like that's really more my excuse is just finding the time to go do it, which is awful to say because y- I am aware of how this affects your body and everything as well. So it doesn't make sense to be I always say to people too, you're so concerned about eating organic or eating, your grass-fed butter, this, that, and whatever, but yet you're ignoring one side of your body that's, like, really critical to your overall health, right? It doesn't
Yeah,
make sense to my in my mind, but yet here I am being a culprit of it. So maybe I'll make my dentist appointment today, but I do need to then say, do you guys do the
saliva testing.
measurement of the saliva or the saliva test and the
Yeah,
measurement of the gums?
yeah.
Now, is that different than the receding gum line and that situation?
It could be, it also could be a factor in receding gums. There's a couple things that can happen in receding gums. One could just be the patient has thin gum tissue, and thin gum tissue just isn't tough enough to withstand chewing and brushing and things like that. That is hereditary, so that does run in families. Another thing that could cause receding gums is how the patient is biting, or maybe they're grinding their teeth, or maybe they're brushing too hard. But then the other one is actually having this pathogenic bacteria that's eating away at the gum tissue and the bone around the teeth. But what is also a good thing to think about too, and I always tell my patients, you only see me 2 to 4 times a year, right? You're on your own the other 361 days. So
Mhm.
come to me, let me do a saliva test, let me get you back to baseline, and then let me give you the tools to maintain on your own. Because I tell people it's just like if you go to the gym 4 times a year and you think you can run a marathon. Like it's not going to happen. It's more important what you do day to day than what you do when you come in and see me. My job is to test, to repair or clean up, and to educate you how to maintain your own health. So go back, see your dentist, let them get you back up to baseline, and then you can maintain it on your own pretty easily.
Okay. So for fertility, the saliva test, what else do they need to be doing? The
So
prior to getting pregnant, I would say.
Yeah. So another really important thing is to make sure that you're getting X-rays taken before you're pregnant. We don't want to take X-rays unless we have to when you're pregnant. But making sure that we're getting not only the X-rays that look for cavities in between the teeth, but also I really recommend getting a three-dimensional X-ray. That's called a cone beam CT scan done because that's going to check three dimensionally around all of your teeth to check for any infections. There's a lot of patients, and myself included, this happened to me when I was undergoing fertility treatment. Of course, my RE didn't say anything about oral health, but being a dentist, I was like, let me make sure that I check everything out ahead of time. And I took an x ray and I had an old root canal tooth that had abscessed, and I had no idea, no pain, no
Hmm.
symptoms, nothing. And so I was able to get that removed and then later replaced with an implant. But you want to make sure you're catching everything and treating it before pregnancy because we know that once you get pregnant, your hormones change. So that's going to make your gums bleed more and become more inflamed. We also know that if you don't have enough vitamins and minerals in your body, the baby's going to need to get them from somewhere and it will leach them from teeth and bones. That's why a lot of people say, I never had tooth problems until I was pregnant. Um, and if you have a cavity pre-pregnancy, some people get sick and so they're vomiting quite a bit. Other people, have really intense sugar cravings or carbohydrate cravings when they're pregnant. So their oral hygiene is not as great as before. And so those cavities will very rapidly progress while they're pregnant. And if they get a tooth infection, that can be very harmful to not only the mom, but the baby. So get x rays ahead of time, get your saliva test and your gums cleaned.
Which leads me to my next question. What about the silver fillings? I feel like my generation, that's what you did. I
Mhm.
think maybe the generation younger than me, it's kind of a known fact that I hope they're not doing that as often or at all. I'm not sure. But what should they be getting those out before pregnancy and or how long before?
Yeah. That's kind of a tricky one in terms of should they be removed. So I will start by saying don't get silver fillings. We have better materials now that are not only better for your teeth but less toxic for your body. So moving forward, don't get silver fillings. They are really prominently used in kids dentistry because they're not technique sensitive. So when you're working on a kid and they're thrashing around in the chair and they're moving and they have saliva everywhere, it's really hard to get a white composite filling in properly because if you get a droplet of saliva underneath that filling will fail and they'll get a cavity underneath of it. And so a lot of pediatric dentists will use silver because they can pack it in and it really doesn't matter what the kid's doing, it'll fill the hole, if you will. So a lot of kids do still get silver fillings, unfortunately. I still don't recommend them. I would never put a silver filling in my kid. Um, Now, in terms of removing them can actually be, if it's not done properly, removing them can actually cause more harm than
Right.
good. So
Mhm.
at that point, it's like you want to look, what does the filling look like? Has the tooth become gray around the filling? Is the tooth starting to crack? If that's the case, the tooth is gray or the tooth is cracking, absolutely get it removed. You want to get that replaced. But if it's a small filling, it looks intact, unless you're having some sort of systemic symptoms from it, it might be best to leave it in place, unfortunately.
Okay. And that raises the question again, these systemic symptoms you may have had for a long time and have no idea that it's starting from there,
Mhm.
right?
Mhm.
So, how do you back that up and say, okay, let me figure this out? Do I start with my mouth and get everything replaced? It seems so like a big situation. Like I have funky stomach, I always have.
Yeah.
Now I'm wondering, like, is it something with my mouth that's causing this? And
Yeah.
how deep do you dig to see if that's what it is? And if it was something like that, is it pretty quick to know, like, oh, I'm feeling better, like my little 4-pound dog did? Or is it something that because we're larger, it's over time that you might notice that it's not so drastic? Because
No,
I feel like
it's
this could
usually
be going down the rabbit hole, right? Of like,
yeah.
is everything that's going on with my body because of my mouth?
It's usually pretty quick if the silver fillings are the culprit. So I'll say if the gums are the culprit or if the fillings are the culprit, patients notice they feel better within a week. It's usually pretty instant. I've had patients call me 48 hours later and say they feel better, even if I just removed a tooth that had an infection that they didn't know about. Um, and so some of these symptoms to look out for are kind of like chronic unexplained fatigue, right? Like you just don't have any energy and you don't know why. Um, Chronic inflammation. So that could be maybe your joints feel achy, maybe your hands are swollen or your feet are swollen, maybe your knees hurt a little bit. Um, these are kind of like sub clinical symptoms, right? That an average Western physician is going to say, oh, you're fine. You don't qualify for a
Right.
diagnosis, but you know something is wrong. That's
Mhm.
when we start to look at the mouth. With amalgam, people can also have brain fog. That's a really big one, is brain fog. The gum bacteria also go straight to the brain. They're implicated in Alzheimer's and dementia as well. So we'll see a lot of brain fog. We'll see a lot of like Parkinson's type tremor symptoms. We'll see a lot of rheumatoid arthritis, any kind of systemic autoimmune or inflammatory condition. Um, it's caused by inflammation. You just got to figure out where is it coming from. And if you've turned over all the other rocks besides your mouth, I'd look there next.
So interesting because that's where we start with the egg quality now, right? We
Mhm.
know that it's not necessarily the age, it's the inflammation in the body that causes the egg quality.
And
So
a big piece of that inflammation is from the mouth. That's what we see with these saliva tests.
so interesting. So with the pregnancy gingivitis, I guess is what it was, for myself. It's like all of a sudden I had gums that were bleeding and my doctor was like, "Oh, it's normal. It's the hormones changing and whatnot." But at first, it's pretty alarming because 'cause you're like, "What is going on? This is not normal for me," right? And something is different, and again, you don't correlate one thing with the other at all. And now that I've been through it, of course, all these pregnant people are telling me, I had to go to the dentist emergency because I could not figure out why my mouth was bleeding so much.
Mhm.
Why is that? And then, of course, as soon as you deliver, like at least for me and the people that I know, that symptom goes right away.
Yeah.
What's the deal with that?
So it could be two different things. One could be that there was a microbiome imbalance prior to pregnancy. And so it just got exacerbated during pregnancy because it is true that when you're pregnant, we double our blood volume, right? Because now we have to make circulation for our baby. So our blood vessels are going to dilate. A big piece of that is from the progesterone that's spiking in our system. So because of the increase in hormones, that's going to cause our blood vessels to dilate. We get more blood flow. But because of that increased vasodilation and more blood flow, we're getting more inflammation too. That's why pregnant women a lot of times feel really swollen. It's because of the increased leakiness, if you will, of our circulatory system. So, if we have an automatic increase of leakiness and inflammation from just being pregnant, which is from the pregnancy hormones, and now you have a little bit of dysbiosis, microbiome imbalance before you were pregnant. You combine those two together, and now you have a big problem. And we know that that bacteria goes straight to the uterus. It impedes blood flow through the fetal artery. It can cause premature rupture of the amniotic membranes and lead to preterm birth and low birth weight babies, all kinds of bad stuff. Now, if you've had your saliva tested pre-pregnancy or during pregnancy and you know you don't have a microbiome dysbiosis, then that pregnancy gingivitis that woman is experiencing is normal. It's just a side effect of being pregnant, unfortunately, one of the many that we get to experience. But the key is making sure that it's not also being caused by bacteria.
Okay. Yeah, that was one of the strange things. I remember also my first pregnancy, I had carpal tunnel, and they're like, "Oh, yeah,
Mm,
that's from being pregnant." I was like, "What? What on earth does this have to do with that?"
yeah.
So I do think that it's good to know some of these random things that are correlated so you don't think that something is urgently wrong. But to start, where would somebody find or what is exactly are we asking our dentist for to go
Yeah,
in for this saliva test? So what is,
yeah,
I heard this podcast and a dentist was talking about a saliva test. Like what is the wording that we use to
yeah.
ask for what we need? And or can people find you and can you do it, you know, from wherever you are? Like is it something that could be mailed?
Yeah, absolutely. So, one thing that I do now, so I'm in the process of opening this really big oral systemic health and wellness clinic in Colorado. Opens April 1st. I'm so excited because we're going to have a whole women's health division of it too, which will be great. But we have functional medicine doctors, dentists, and women's health professionals all in one practice to serve patients. But in the meantime, yes, they can contact me and purchase a saliva test. And it'll get shipped to their house and they just swish and spit and send it back in. And then once the results come back, I will work with the patient on creating an oral health and wellness plan. And then I can work with their existing dentist and help them get the care that they need because I have to be honest, less than 10% of dentists are doing this. And so I can either coach their existing dentist or I can help them find a new one that does do this type of treatment. But I would start by going to your current office and asking for a bacterial saliva test or a microbiome saliva test. That's what it's really called. And if they don't have it, then obviously you can contact me and I can get you one. But start with your dentist first because they're going to be the one rendering the care. But always also get your gums measured, request it. It's really
Okay.
important.
Okay. We have some homework to do. So
Yeah.
where can people find you?
They can go to my website, which is katieleedds.com. And on there, they can book some time with me. They can book a consultation and get a saliva test there. And they can also find me on Instagram at katieleedds. And then my new practice, we do have our extended homepage up. And people can join the mailing list, get all the kinds of updates on what the center is doing, and they'll get information too about oral systemic health. And that website is collectivehealthsociety.com.
Awesome. Thank you so much for the information. Oh, actually, as I'm getting ready to sign off, I'm thinking, wait, there's other questions I want to ask, not related to fertility necessarily, but to the kids. My kids grind their teeth so much. I talk to their dentist and they're like, it's not really, there's not a lot we can do about that. Why is that? That I have three kids, they all do it, some
Yeah.
more than others. And I literally got to a point where if they come in my room at night, I have to put headphones on because I cannot
Yes.
deal. It's like I'm like constantly like touching their mouth and
Yeah.
whatever. Why what is going on with that?
I remember my parents used to come and shut my door in the middle of the night because they could hear me down the hall.
Hmm.
So the biggest thing that we want to check when it comes to grinding teeth as kids is their airway, because more and more kids are having airway issues that are going unnoticed and undetected,
I
and then
do
they
see
end
that
up.
it's worse when they have a cold.
Yes, and then they end up either having ADHD, maybe they have behavioral problems. A lot of kids will get recurrent ear infections and sinus infections. If you have a kid that's like they're getting tubes in their ears or have recurrent ear infections, I'd look at airway 100%. Or if someone has ADHD, I'd look at airway because oftentimes if we can adjust that, those symptoms will go away.
So is that an ear, nose, and throat that looks at airway or
Um,
the dentist?
I would go see a dentist. There are organizations out there that will specialize in pediatric kid airway that will do a full workup and see if your kid needs what's called expansion. So oftentimes the palate, so the upper jaw, is not, it's too pointed in kids, it's too vaulted. We want their palate to be more flat. And so a lot of times with kids, we just need to help their palate kind of expand a bit so that way their sinuses will open up and they can breathe. This will fix a lot of ortho issues down the road and fix airway issues and fix a lot of cold issues, to be honest.
Okay, interesting. Because I didn't notice I had grinding teeth, but not until I was an adult. And the kids dentist, she's like, they probably won't wear a mouth guard and they're so expensive and they grow. And I tried to get some of them on Amazon and we did the whole thing and none of them want to wear it, which I don't blame them, but it's it's crazy.
Yeah. So it's called health. It's called Healthy Start. I just looked it up. I was trying to find it. So Healthy Start is one of many. I'm not affiliated with them at all, but kind of a cool story. My best friend, I went to see her in Chicago not too long or a couple year ago maybe, and I could just tell by looking at her son that he had underdeveloped maxilla. But like, being a dentist, I'm not going to just walk around giving my opinion to people. And my friend said, he keeps getting recurrent ear infections and he's sick all the time and he's just tired and he just looks lethargic. And I said, I think he has a skeletal issue. I need you, go take him here and they do free consults, just have a look and see if it's an airway issue. Sure enough, it was. He's had expansion. I think it was like 6 months worth of treatment, and ear infections are gone, rarely gets sick, whole new kid, no behavior issues, all from
Amazing.
expansion.
So cool. It's again one of those things that you don't know until you hear somebody talking about it. And I would, if you were my friend, I'd be like, tell me all the things. Look at
I know. Then
everybody.
she was then she was like, "If
Tell
you
me
ever notice
everything.
this again," yeah, she's like, "Have you noticed this for a while?" I said, "Yeah." She said, "If you ever notice anything about my kids again, you need to tell me." And I'm like, "Okay, okay."
Yeah, exactly. And then what's your opinion on teeth whitening?
Totally fine. It's one of those nice cosmetic stuff that we want to do. Make sure your gums are healthy first, because if you put bleach and it gets on inflamed gum tissue, it will burn your gums. So make sure your gums are healthy, but otherwise, I think it's fine.
Okay, because I have again people come to ask me that, prior to getting pregnant, and I'm like, you
Yeah,
got to ask your doctor. I don't, that's
yeah.
something that is so not really
Don't
brought
do it
up.
while you're
Nobody's
pregnant.
talking about it.
Yeah, don't do it
Yeah,
while you're pregnant. But
right.
before, if you're not having any, if you have too sensitivity or if you have very sensitive teeth, I wouldn't do it because it's going to make it worse. But if you have, normal teeth, your gums, are healthy, it's fine.
Awesome. All right. I will let you go back to your busy life, but thank you so much for spending time with us and educating us on all the things that we never knew we needed to know for ourselves and our little ones. And I'm sure we'll have a lot of questions coming your way. I know I definitely need to get on the phone and make my appointment now and ask specific questions. So we'll see how that goes. I'm curious to find
Yeah.
out.
Yeah. Well, good. Thanks for having me.
And good luck with your new wellness center.
Thank you.
Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.